Hello, friends. This is another newborn feeding episode. So we're kind of moving forward from breastfeeding on to combination feeding. So we have breastfeeding, we have breastfeeding with or pumping or other. And then I'm going to do one on formula. So formula feeding will be the last one. Let's talk more about what other options you have besides strict breastfeeding, because many women know how hard breastfeeding can be. As we talked about in the last episode of this, women's milk doesn't come in until day 4 or 5 with our first baby, sooner with second or third babies. And of course, with time, age, stress, etc., as we get older, with prematurity of babies, stress, things like that, your ability to make milk can change. So whereas you might have had a very great experience or easy experience with your first baby, it might not be the same with your second, or their mouth shape will be different. And of course, then you have your first or second child running around the house, distracting you, or being part of that stress that, creates difficulty with milk production. So what else can you do, and what does that look like? There are plenty of options that you can do besides strict formula feeding. And we'll do a strict formula feeding one, and that's a completely acceptable option. If you are not ready for that option, then we can talk about things like supplementation, or pumping. And, I have many patients that strictly pump. I think it's incredibly brave to do that. It is very time consuming. So, I always talk to my moms about pumping being a extra time constraint, right? Because not only do you have to spend time pumping, but you then have to then feed the baby, right? So it's double the work. It's still amazing because you're giving the baby breast milk, but you have to be able to spend the time pumping and keeping up your breast milk production, and then also feeding the baby. So obviously in the beginning, you might have extra hands at home. You might have moms, dads come visit. You might have your husband at home, or your, boyfriend, and that might be a very helpful thing. Or you might have a preemie baby who's in the hospital, and it might be easy for you to do it then because you don't have the baby with you. And so those might be very easy times to be able to do it. To maintain it is harder when you're by yourself at home. Obviously, they make it as easy as it can be, with bras that you can put the pump in, or the ones that just kind of fit into your bra. You have to have the right flange, which means, the right shape for your breast so that it is effective. And you do need to have it on the, simulation first, and then the setting that allows the milk to come out. So that's one option. And of course, many moms will do that at work, once they go back to work. Another option is, breastfeeding and supplementing with formula. So, this is something I had to do with my fourth kid, because I didn't make enough milk and he needed more than what I could supply him. This feels a little bit devastating for some women, because it feels like, our jobs to do this. And sometimes it's overwhelming when you feel like you haven't been able to do what nature has told us we should be able to do. So I want you to understand that you're not a failure. It's happened to many women before you, and formula or supplementation is perfectly acceptable if you need to use it. You might need to use it temporarily, such as in a situation like jaundice, where we need to treat and get the baby pooping in order to get the jaundice treated as quickly as possible. Or we're doing it to boost the baby's calories because the weight has not started to come up after the second week or third week, and we're starting to feel like maybe you're making more like skim milk instead of like fatty whole milk. And, we're just seeing more of a straight line from baby's growth instead of like a little like this. And we might say, hey, maybe we need 1 bottle a day, or maybe we need more than that, or maybe in some cases we need extra calories per ounce. And so we have to up the calories per ounce. There's a lot of different things that we might need to supplement for. And many times that could look like breastfeeding and then formula, breastfeed, then formula, or breastfeed through the night and in the morning and then daytime formula, or the opposite, formula through the night and breastfeed during the day. We could do it in many different ways. It depends on the issue, and depends on what we're trying to accomplish with it. If this is a problem that we deal with maybe at 4 months and you have stored milk, we can supplement with stored milk. Of course, if the issue is that we need increased caloric intake and we're trying to increase the calories per ounce, we may need to mix up a, thicker amount of formula per ounce. And so that might be what we need to do for that particular situation. In the NICU, they're going to have specific plans for your baby. And I know they're very breast forward for a variety of reasons. And that's they're going to try their best to get your baby to have formula to have breast milk, and then only use formula if absolutely necessary or if it's your preference. So these are a lot of variety of options that you may be wanting to do or have to do. If you have to do it, I don't want you to feel as though you're the failure. The other reason you might have to do it is medication, infection. There are a lot of reasons, and if that's the case, you need to talk with your pediatrician or your OBGYN to double check. I have to take this medicine for whatever the reason, postpartum depression or infection like mastitis or HIV or a variety of other things. You're going to have surgery and you are going to be under for 24 hours, and what do you do? So just always check. We have a breastfeeding guide, and it gives us a scoring system as to how the medicine is, excreted into the mother's breast milk. So tomorrow or the next day, I'll talk about formula and formula selection, which is a huge topic, and we can go over a little bit of how to choose, why there's so many formulas, and it's a little bit overwhelming. So I'll try to break it down for you. All right.